This is the preoperative pictures of this patient with quite significant segmental scoliosis. And as you see here, the curve angle I'm going to measure between L here and T12 is about 51 degree. And here you see that there's significant degenerative changes. And more important than that, I see the rotational, this is post-op, this is the rotational deformity is more concerning. Now I'm going to show the post-op pictures. The surgery just was today, and the surgery was about 1 hour and 40 minutes, where we actually correct the scoliosis with transcameral OLLIF. This is the post-operative, and it's pretty much straight. The only place is L2 on the right side that I put a screw in. I wasn't happy, I took it out. So we are going to look at the screws now. And here is spacers are well positioned strategically to correct the scoliosis. Here the screws in T12 are well placed. The pedicles in L1 and L2 were extremely small, so I chose bigger screws and extrapedicular screws. On the right and the left side is good, but on the right side, if you look carefully, the pedicle is extremely small, so I chose extrapedicular approach. In that L2, actually I did put a screw in, but there's a hyperostosis there here, and I didn't want to pound too hard, and I put it in and took it out. And then here you see the screws in L3 well positioned, and in L4 as well, very adequate. And here is the post-operative 3D view, and here I'm going to measure the curve angle now in the same levels. It's not completely corrected, but this was, if you remember, it was 52 degrees. It's now 17 degrees, so 2/3 of it is corrected, which is pretty adequate. Now I'm going to show the x-ray of the surgery. Here you see that we are getting actually quite significant acrobatic of the C-arm to get a good picture. Here is, I'm marking it on the skin, and here you see I'm visualizing bottom up. We did a T12 to L4 4-level fusion, 8 screws, 4 spacers. So I put the Jamshidi in, get the bone marrow, then same on the other level. Once you have a good picture for one level, you just have to use the opportunity to finish the work for that segment. And then I do the more bone marrow, so I put as well screws in the L3, and now I approaching the disc, enter it. In this level I put the cage more to the left side, and I do an in situ rotation. Here it goes in and it turns, it goes in and it turns. Then I just reposition it for every single other level, and as you see here, I get the best picture I can now for that level. And then I start putting the cage in there on the opposite side, on the right side, because I want to open up that scoliosis on the other side. And here are the pictures. Then you see the pedicles on the right side are extremely small. Here I put them in. Then we go on to reposition it for T12 L1 L2. Here again I enter it and put the cage to the other side to correct the scoliosis. You see as well when I'm packing the space with biologic that it goes dark inside of the disc. So here the cage is going in, again to the right side to correct the scoliosis. And then the last level for thoracic region, I put the pedicle in the This is L1 and T12. And once all the K-wires are in place, I finish up the disc work for T12 L1. Again, I put the cage to the other side, and this is the final picture here. Here, obviously, after I put that thing in, I put the screws in, and then I decorticate. This is the decortication device that decorticates the surface of the bone. I made a video I'm going to put online about how this is used. And then once the screws are in, so you see there's still significant scoliosis, but we measured that. It went from 52 to 17 degree. Now I put a rod in place that bent proper way on both sides, and then I obviously lock it in place and close the skin. Surgery was 1 hour and 40 minutes. And here is the final lower part and final upper part of this of the thing. And we obviously looked at the final result that significant part of scoliosis is corrected. So this patient usually go home next day.